Welcome to Wellness Wednesday. As you know, every Wednesday we go live at 5, and this week I'm super excited because we are talking about holistic options for fertility and hormone balance. Now, when it comes to fertility issues, when it comes to hormone balance, there is a lot to understand. Now, in previous videos, I've talked about stress and hormones and how those all kind of work together, but I really haven't gone into much detail on how that affects fertility and more specifically hormone balance when it comes to families, when it comes to having children, when it comes to being pregnant, when it comes to being a mom and dealing with your kids, or even being a dad and dealing with your kids. One of the things that I find is really interesting is when we look at stress, when we have chronic stress, where we have long exposure to stress, or if we had early childhood trauma exposure, where we had either neglect or abuse or even emotional issues going on within the household, that chronic exposure to stress or growing up with stress actually can change how our body works and how our body responds to stress on a daily basis. I talk a lot about adrenal damage, adrenal stress, adrenal fatigue, but that is literally one piece of the puzzle. So if you look at research, more specifically on adrenal damage and adrenal stress, it doesn't really exist. And the reason is it's actually called HPA axis disorder. So HPA axis disorder is basically a triangle. We have the hypothalamus, pituitary, and adrenal gland that all work together to balance each other out. Typically, that is going to be your response to just emotions. That's also going to be your response to kind of balancing hormones and getting organ system functioning. And then your adrenal gland, which is, I think, one of the most important parts, and that's because it does respond and it's easier to adapt and actually help that organ and that gland work a little bit better. That adrenal gland is responsible for stress response. So every stress in your life, whether that is your blood sugar dropping, whether that's your boss or your husband yelling at you, whether that's the stress of overworking yourself or not being able to pay bills or whatever stress exists in your life. So even if you're working really hard in the gym, even if you are maybe having some health issues where you have imbalanced blood sugar or just chronic inflammation and stress going on in your body where your body's constantly trying to heal itself. Autoimmune conditions a lot of times can cause this as well. But in some of the newer research, we've actually seen some links with HPA axis disorder specifically and chronic fatigue syndrome. So those two go hand in hand. And basically what we see is when we have that long-term stress or early childhood stress that kind of changed how our brain and our body functions, we are overactivating that hypothalamus, pituitary, and adrenal gland so it can respond to stressors and it can respond to what's going on in our life. The problem lies if we are constantly stressed and we're constantly challenging that gland over and over again, it can definitely respond and it's designed to respond. Stress is a good thing to have our body able to respond to it. But when it's chronic and long-term, we can start to see where the adrenal gland starts to burn out and we start to get where the gland can't react as well. Or after dealing with the stress, we kind of crash a little bit and we need some time to recuperate and kind of heal up after that. And eventually we can get to the point where basically our body kind of shuts down and our organ systems kind of put everything on hold because we've overburned and burned ourselves out so much that we just can't get back up out of that hole that we've run ourselves into. One of the things that's really interesting is when we look at chronic fatigue syndrome, or more specifically the HPA axis disorder, the kind of the link between those, we see that when we have that chronic overactivation of that corticosteroid feedback loop, we get what's called more of a negative feedback. So after working so hard, eventually we'll start to see where it tells everybody else, like say, for example, your adrenal gland, I like to call it the queen or the king gland, depending on if you're a man or a woman. And what I found is that when we have that crown, that adrenal gland getting overworked, that is the queen, that is the king. So everybody else has to bow down to it in your body. When that gland is using up resources, when we start running low on resources, your gland will actually tell the rest of your body. It'll tell your thyroid gland, hey, you know what, take a break. Let's go ahead. We're going to go ahead and go into a hypothyroid situation. And we're going to start to see where our thyroid hormones reduce because the adrenal gland is stealing away all the Lego blocks to make its hormones. And there's nothing left over for thyroid gland. We can also see issues where your body's immune system will start to decline. So we'll start to see where adrenal gland's gobbling up all the Lego blocks. Your immune system starts to not quite respond as well. We don't heal as quickly. We may get sick more often because that immune system has had to take a back seat because the adrenal gland that queen or king needs everything and it starts stealing away all the Lego blocks. So there's nothing really left over for that immune function. And what's really interesting is when we start to see where immune function decreases, you have different types of immune response. So you have a external response where your body is reacting to things like seasonal allergies or dander, or foods or things like that, where basically things in your environment, pesticides, chemicals, your body overreacts to those. A lot of times we'll see more issues with symptoms in that case. So a lot of times we'll see, more allergy symptoms. So itchy eyes, hives, things like that can happen. We can also have internal allergies. So sometimes what will happen is after you eat food and your body starts digesting it, your immune system starts reacting and actually breaking down those chemicals and actually forming an immune response. So every time you eat, especially if there's certain things that you're reacting to, your body starts to go into like inflammation response. As soon as you eat that food, your body starts to partially digest it. Your immune system goes forward invader and attacks it. And we can start to see a lot of digestive issues. So a lot of times if we're having bloating issues, if we're having issues with diarrhea or constipation where it's going back and forth, or just as soon as you eat, you get pain or have to go to the bathroom right away, those are all symptoms that your immune response has maybe been heightened, and that's affecting your digestive system. The other really important thing is when we have that increased stress, especially over a long period of time, your body will literally shut down digestion and it'll shut down rest and sleep pathways so that your body can deal with stress. So a lot of times we'll see where if we've been under chronic stress for a while, we start to see digestive issues. We start to see heartburn. We start to see issues where potentially we may see some problems where our body may have reactions. So every time we eat, we have an issue, and then we feel like we're miserable every time we eat. So we stop eating, or we eat less throughout the day so that we don't have as many issues. And what actually happens is when we eat less, especially if we're getting less nutrients, the adrenal gland runs out of resources faster. And a lot of times we'll see other systems kind of snowball where we started with this one little thing that's gotten bigger and bigger and bigger and bigger until eventually we can have multitude of systems, all these little vague things that kind of add up to cause a whole health host of problems. And one of the things that I find is really neat is when we do look at digestion, when your body is not digesting well, it's going to lower your metabolism. It's going to try to conserve all resources. So a lot of times we'll see metabolism change. So when your body is not digesting, when you're not getting the right foods, your body will lower metabolism. You're going to start to gain fat, and your body's going to start to put everything in storage because it's in starvation mode. So if you've been trying to lose weight, or if you have been trying to diet and you're noticing nothing is changing, or you feel like no matter what you do, what you eat, how you exercise, it's not changing, there may actually be a hormone component of that where that adrenal gland and that HPA axis is actually off balance or out of place and not working properly. Another thing that I see a lot of times, especially with the HPA axis disorders, is when we do see that balance go off with that triangle of the hypothalamus, pituitary, adrenal, we can actually start to see a neurotransmitter imbalance. And when our neurotransmitters in our body are out of balance, that's going to affect our mood. That's going to affect and actually can contribute to irritability and anger. You may notice that the things that you used to be able to get through, just the slightest thing kind of just pisses you off, and you get irritable and you get angry and you have this rage that just doesn't really seem like yourself. You almost feel like, I'd feel like I just can't deal with any stress, and the slightest thing sets me off and I want to explode on everybody. That mood impact is coming from that hypothalamus pituitary throwing off. But the other interesting thing is too, when we see that mood imbalance go off, we can also see issues where because we are having that negative feedback loop so much, and we're having that chronic stress, and we're having that nutritional deficiency because of digestive issues, we can start to see issues with anxiety and depression. Not because we're having a lack of medication, but because your body's not working properly. The food you eat gets digested, so you have resources that your body uses to make your hormones, that your body uses to build your muscles, that your body uses to do all of the things it needs to do. And if it's not working properly, we can start to see a breakdown. So if you have anxiety, especially, I've seen this a lot in teenagers, unfortunately, but if you have anxiety and it starts going into panic attacks, that means we have a major issue going on. Your body is literally running out of resources. Your body tries to conserve as much as it can. And if you're not getting enough in your diet, it may start to break down muscles, which can lead to joint issues and back pain, and also degeneration within your joints, because your muscles help to open up your joint spaces. So when you break down your muscles, you get more pressure on the joints and they wear down faster. But we'll actually see where your body will digest that muscle to give you resources that we're not getting either through our diet or through digestion. So a lot of times when we have or when I have patients coming in that are dealing with specifically anxiety, whether they've been on anxiety medication or if they've had depression in the past, or if they are currently dealing with some type of issue with panic attacks, usually the first thing I like to do is look at what are we eating and how's your digestive system working? And if it's not, we have to start there, because those are the two most important things for your body to function. But also, if we do have an HPA axis disorder, how we need to heal. And I mentioned fertility already, but what's really neat is when you look at that adrenal gland. So when that adrenal gland is needing more resources, it's going to actually steal one of your precursors called progesterone that turns into all of your other hormones. Progesterone is actually used in a lot of different systems in your body. That progesterone actually can turn into aldosterone and help with blood pressure regulation. So a lot of times when we start to see that HPA axis disorder and some of that hormones getting stolen away, we'll actually see where the blood pressure is very hard to stay stable. So when you're sitting down or lying down and you go to sit up, you may get some dizziness or feel off balance. Or if you're going from sitting down and standing, simply the stress of standing up when your blood pressure is supposed to raise 10 millimeters of mercury just to help push blood flow to your brain is so stressful, you get lightheaded, because as soon as you go from sitting to standing, your body can't deal with the stress of simply raising blood pressure 10 points. So you'll get a little bit of dizziness, or you might get a little bit of off steady feeling from that specifically. And a lot of times that can be a signal, if you have some blood pressure issues going on, that we may have an issue with that HPA axis. That adrenal gland may be stealing some of those hormone precursors away, and your body's having trouble regulating blood pressure. But when we look at kind of that pathway, that progesterone is super, super, super important, specifically for healing. Your body uses progesterone to heal. Your body uses progesterone to help smooth muscle relax. So that means we're going to see our heart muscle. We need calcium to contract our muscles, magnesium to relax. But in order to keep our blood vessels nice and open and patent so that they're not tight and causing high blood pressure, we need progesterone to relax those. So smooth muscles are not only found in your heart, they're found in your blood vessels, they're found in your lymphatic drainage. So if you're having a lot of sinus issues, or if you're having a lot of muscle cramping, tension, muscle soreness after activity, your lymphatic system may not be draining those waste products out properly. That smooth muscle is also going to be found in your digestive system. So your stomach, your intestines, being able to use the restroom. If you have low progesterone, a lot of times we can also see issues where you may have constipation. You may notice certain times a month it's a little bit worse, especially about a week or so before your period or right before your period, because your progesterone normally is low at that time. But if you already have progesterone being stolen away, you may be literally scraping the bottom of the barrel because there's really nothing left there. What's really interesting to me, I have dealt with PCOS myself, and I have had quite a few women in my office that have dealt with PCOS, and they have tried every fertility method out there, everything from doing injections to doing IVF to doing all sorts of things, and may have struggled with fertility. But as soon as we try to get a handle on what's going on with the HPA axis disorder, what's going on with the adrenal gland, what's going on with the hormones, what's going on with that kind of whole pathway on the other end, if we start trying to balance and support that system, a lot of times your body has the capability to heal itself. And we'll actually see those hormones regulate so that you can get pregnant without the need for medications, without the need for fertility drugs that have some pretty horrific side effects in some cases. But what's another thing that's really important too is if you've had a lot of miscarriages, a lot of times, our body, once we have implantation happen, your body has to raise your hormones to help you sustain that pregnancy. In the first 12 to 18 weeks, depending on when that placental hormone takes over, your body is reliant on your own production of progesterone to sustain that pregnancy. If your progesterone level is not high enough, or it doesn't increase like it's supposed to, a lot of times we can have miscarriages early on in the pregnancy due to progesterone deficiency. So if you do have the HPA axis disorder going on and the adrenal gland is stealing away your progesterone, you may not have enough progesterone to, number one, signal a period. So if you have irregular periods or your periods kind of skip all over the place, your body has to actually have progesterone dip to signal your period. So if it's always low, you're not going to have a period. But if you do get pregnant and progesterone stays low and can't rise because it's getting stolen away, that can lead to miscarriages, especially in the first 12 to 18 weeks. Typically, placenta hormones take over after that point, but that first trimester typically is all reliant on your body. And if it's not working right, that may cause some major issues, not only for, like I said, having a menstrual cycle and ovulating properly, but also sustaining a pregnancy, being able to keep that pregnancy going, because progesterone levels need to stay high. most important in that first trimester, but we need to have progesterone throughout our pregnancy. Progesterone also helps with joint stability. So if you're noticing you're getting a lot of snapping in your joints, especially in your hips and knees, or if you're noticing a lot of instability like in your shoulder, you go to throw and everything's popping a lot more than it's supposed to, that may mean that, again, you have that hormone imbalance where progesterone is not keeping those ligaments tight to keep your joints together, but it's allowing some slop where things can rub and irritate, and we can actually have more joint pain. We can have more popping and snapping specifically from that. Another thing to think about too is when we have that adrenal issue going on, your body's stealing away resources, and we'll actually see some of the resources that help with our sleep hormones can be affected too, and our energy. Because what happens is, because your adrenal gland is literally stealing away those Lego blocks, you're going to run out of Lego blocks to make some of your hormones that help with energy. That's a lot of times why chronic fatigue syndrome is associated with HPA axis disorder, is because our body's literally running out of resources and adrenal gland has to work or you die. So whatever's left is what the rest of the body gets, that if you don't have enough, so what, tough deal, that's what's going to happen. And we're going to start to see symptoms from that. But like I mentioned, not only are you going to see issues where you are having trouble getting to sleep because your sleep hormone is not increasing to help you go to sleep, you might notice that you have no problems going to sleep because you're, extremely tired, but you're waking up in the middle of the night for no reason and can't go back to bed, because that sleep hormone, typically about half an hour, 45 minutes before we go to bed, when we have darkness touching our eyes, your body will start to rise melatonin, and it'll actually have some other hormones in your brain that actually depress and kind of slow down brain functions. If your mind's racing, you got a million things on your mind, you're not feeling tired, those are all symptoms that you may have an issue where some of those sleep resources for your hormones aren't working for you. But like I said, when you're not sleeping, you can't heal, which means you can't bounce back. You're not going to have energy the next day, but also that adrenal gland is going to contribute to energy loss. It's going to contribute to fatigue in the long run. And one thing that I think is really important to understand is when you have an HPA axis disorder, that's going to affect a lot of other body systems. I mentioned already, we're going to see energy production. So a lot of times chronic fatigue syndrome, we'll see a lot of blood sugar imbalances. So patients that have diabetes or pre-diabetes, or patients that are noticing that after eating a meal, they're almost like crashing, like they need to take a nap. Those are symptoms that your body is having trouble regulating blood sugar to keep it nice and steady. But we may have where you eat a meal and all of a sudden your body overreacts and crashes because it's in like panic mode. And that can cause a lot of issues, not only for, like I said, pre-diabetics, patients with diabetes, but also women that are dealing with gestational diabetes. We can also see issues for women that are having fertility issues. A lot of times if your insulin level is high, that's going to interfere with hormone production. And again, that can cause issues where you're not ovulating properly. I mentioned already PCOS. PCOS and fertility are tied hand in hand to blood sugar balance. A lot of times when women are having trouble with ovulating, the doctor will put you on metformin to specifically help manage blood sugar better, hoping that that by itself will help you be able to ovulate and actually care or get pregnant to the number one. But then again, if you don't have that progesterone level where it needs to be, we may lose pregnancy very early. So if you've had, a lot of issues with PCOS, if you have irregular periods, if you've had, very heavy or painful periods with a lot of symptoms, those are all symptoms that those hormones are not working properly, because progesterone is super important. But progesterone is what I like to call the sanity hormone. That's the one that keeps your joints stable, keeps your digestive system, your blood flow working, helps with healing response, helps with mood balancing. And then you have your lovely estrogen, which is what I like to call the crazy hormone. That's the one that causes PMS symptoms. It causes us to gain weight. But that estrogen can also affect a lot of other things. Estrogen by itself, if it is higher than normal, can actually increase your risk factor for every single type of cancer out there. So it's very important, not only for just everyday function and stress reduction and fertility, but when your estrogen level is high and we don't have progesterone to balance it, or your body's not managing those hormones properly, that can cause increased risk factors for cancer, and every type of cancer, not just breast cancer, not just ovarian, but every single type of cancer out there. High estrogen levels actually are associated with that. So very important to realize that, when you're dealing with a fertility issue, or you're dealing with hormone balance issues, and you're noticing that you are having issues, whether it is fatigue, whether it is blood sugar balance, whether it is ovulation, whether it's sustaining a pregnancy, whether it is just simply having a period and they're all over the place, and you don't feel like yourself, or you don't feel like, you should be, and your mood's off, those are all symptoms that your body is trying to tell you something's not working right, and is trying to adapt the only way it can, which is taking that HPA axis disorder, twisting and turning and trying to do what it can to balance out and support those three pillars, because the HPA axis disorder, that hypothalamus pituitary adrenal, directs the function of your mood, directs the function of your anger, your sleep, your irritability, directs the function of every single gland in your body, your immune system, your stress response. Every single thing is underneath that HPA axis disorder. That has to work, or your body shuts down and you die. So very important to realize that, if you are having issues of fertility and hormone balance, you need to, number one, figure out what is going on. What is happening in your body throughout the day? A lot of times if you talk to your medical provider, they do blood testing. Blood testing, I think, is great because it gives us an idea about what is happening at exactly that single point in time. But one of the important things to realize is your hormones change throughout the day. So if you have issues at that, in the very beginning of the day, it may show up in a lab test. But if your issues happen later on in the day, that blood test may not reveal too much. The other thing too is in the morning, your cortisol level should be nice and high and then kind of dip and taper off throughout the day. So when you're looking in the morning, they're looking for a very large range rather than specifically, are you where you need to be at that single point in time of the day? Because they're looking, before noon, it should be somewhere in here. But in reality, in the morning, it should be high. And then by noon, it should start to taper off. So again, that big range, they're looking for anything in there. And in reality, you should be at the top of that wave when they're doing that lab test. So a lot of times, I've had people that have had blood testing done from their doctor, and it showed everything looks good. Cortisol's fine, everything's good. And then I look and we do a daily test. So we actually do samples throughout the day to see what's happening different points of the day. And we find that, at noontime in the evening, you are crashing. We got an issue there that we've been missing for a while because of the blood testing. So typically I say the number one thing you need to do is find out what's going on. So that may be simply sitting down and looking at all these different symptoms that you may be having to kind of figure out, where did it start? Is it an adrenal issue? Is it a dietary issue? Is there a digestive issue going on? Is there autoimmune or inflammation problem going on in your body that it's starting to stress the adrenal gland, and that's why it's overworking? We've got to kind of do some problem solving. And with that, you have to look at big picture approach. You have to look at, like I said, what you're putting in your body, how your body is digesting it. What is it making, or is it not making the hormones properly? Is the adrenal gland jumped in and starting to steal away stuff? There's a lot of different factors that kind of play into your hormones. So we may need to find out what's going on. A lot of times too, if women have had fertility issues in the past and they've been on birth control, or they've had Depo-Provera, or they've had IUDs, a lot of times your body has not been regulating hormones correctly, because when you're on a birth control, that is a chemical menstrual cycle, not a normal menstrual cycle where your body is going through hormone waves and the ovaries and the fallopian tubes are working together, help with ovulation. So sometimes if you've been on a birth control or other hormone medication for a while, or other method of birth control, we may have where the body doesn't even know how to have a normal menstrual cycle. So we have to get it working, balance it, and then we can actually have things work well. So if you've had hormone balance issues, like I said, anything from fatigue to sleep issues, to digestive problems, to metabolism problems, to anxiety, depression, those are all signals that your body is not working and balancing hormones properly. And that is definitely something to look into. So number one thing I say is, number one, figure out what is going on. Number two, we've got to come up with a plan. What is the first thing we need to address and start working on to get your body functioning and healing itself? With that, it may be diet, there may be supplements involved, there may be some working with a counselor or working on stress reduction techniques at home. There may be some changes that you specifically yourself can be working on at home to support the body and support that healing process to get it working again. So like I said, typically in my office, I sit down, I want to have a one-on-one consultation with you to kind of figure out, where do we need to start with hormone testing if necessary, then doing hormone testing and actually going over what it all means, what you can do to help, especially if there's a specific time of day that you're struggling, coming up with a plan for what we need to do with all of these things to help your body heal. From there, typically, when we have HPA axis disorders going on, it takes a minimum of about 3 months to get things back to normal and getting things healed. If you actually have damage to the gland where it's not working properly and there's other metabolites that are out of position and are not in proper range, we may actually have to heal the gland and support it and get it working properly again. So there may be more steps involved. Typically, like I said, it takes a minimum of 3 months. I've seen some that took a little longer, more like 6. If you've had issues going on, like I said, if you've had early childhood trauma, repetitive trauma, chronic stress, we can see kind of further damage happen with that. But number one thing, figure out what's going on. If you want more information about this and how that pathway works, I do have a previous video talking about stress and hormone balance. That would be really great. That actually has some visuals that go through how it all works together. And I talk more specifically about hormones like insulin, as well as melatonin and things like that too. So that's a really good video if you'd like more information. Well, hopefully you learned something today. I try to kind of break down things into bite-sized pieces so you can understand and grasp little concepts. This week we talked more about fertility and hormone balance and how that affects a lot of different things in your body. Next week, we're going to talk more specifically. As you know, this month has been all about family care. So talking about how chiropractic and how our office can support you and your family through every age, through every stage of your life, through every type of different condition. I have in my office, because we're a family office, we do treat babies. So babies that have had difficult labors, babies that are having issues with failure to thrive, babies that are having issues with nursing, with digestion, with constipation. I've also worked with children that have had some behavioral disorders or had some development disorders. Sometimes simply improving that brain-body connection, improving digestion can help their bodies heal and function better. Then, of course, as kids learn how to walk and crawl, they fall down a few times. As they get a little older and they roughhouse and play sports, we can see more injuries from that. As they get into teenager years and college, they're sometimes not eating the best things and their bodies need more support as they go through their daily life. And then, of course, as we get into young adulthood and starting a family and having a career and dealing with the stress of dealing with careers and families and managing everything, to going through menopause, which is a whole new stage of life, and kind of shifting your focus from family to more kind of internal reflection and what are you going to do, and did you fulfill your dreams and what you wanted to do with your life. And then, of course, as we get through menopause, we get into more older age. We may be retiring, we may be trying to get out there and spending time with family, doing things that we haven't been able to do, traveling the world, playing golf, doing hobbies and things that maybe you haven't really made time for. And if we haven't really been taking care of our body along the way, we may have some aches and pains, we may have arthritis, we may have some digestive issues and health problems that are kind of standing in the way. So a lot of times we can help not only from a chiropractic standpoint, but from a holistic standpoint, kind of figuring out what can we do to support your body so you can keep up with yourself and what your dreams are. And then we also have patients that do have genetic disorders. We have patients that have had previous surgeries. We have patients that are in wheelchairs. We have patients that have all sorts of a host of health issues that we're able to work with and trying to support their body through that, and even working with other providers to make sure your body has what it needs. So like I said, we're a family healthcare office, and we literally support you through every age, every stage of your life, every health condition. We can provide some type of support or advice or information to learn more about and talk with your doctor about if necessary, so that we're all on the same page, working to help you heal and feel better too. So like I said, this week was about fertility and hormone balance. Next week, we're going to talk more specifically about earaches and bedwetting. Another thing to think about is earaches and bedwetting a lot of times happen in kids more often just because of anatomy. But as we age, if we have deterioration of some of those same structures, a lot of times as we get older, we may see that we're having issues with chewing. We may see we're having issues with headaches. We may see we're having issues with incontinence or even painful sexual encounters due to pelvic floor imbalance. We may have issues with voiding or using the restroom, or any type of issues in that lower back or pelvic floor area, or even sciatic pain, a lot of times can come back to those same structures. So we'll be talking about next Wednesday. We go live at 5, and like I said, that's going to be holistic options for earaches and bedwetting. But I'm going to take it one step further. That's the initial stages. Kiddos a lot of times will have more issues with earaches, but we can see also issues with jaw pain, ear pain, hearing, as well as incontinence and pelvic floor issues later on in life. So that's what we're going to talk about next week. Thanks so much for joining us this week, and we'll see you next week. We go live at 5 o'clock.